Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, March 11th, giving you the update from Albany Med. All right, we pop open the first graph. We're looking at the capital region, people currently in the hospital with COVID. We predicted this on Tuesday when we were at 101. We said we'll be under 100.
That's right.
And we are at 92, which is wonderful
Fantastic.
news. Fred, on that graph, there's also a measurement of people in ICUs, and there's 22.
Right, so that's a small number as well. That's really terrific. That's where bad things can happen to people, so glad that number's going down.
But when you think about that, that's over 7 different ICUs in the capital region.
That's
so
right.
22 is certainly a number
number
that is small. Next graph is admissions and discharges here to the medical center. What I want to point out today is below the graph, when you see those areas that are black, those are people who unfortunately have died.
Yes.
The good news is we're seeing less of that on the graph, which
That's
means thankfully recently we've had less people who actually died from COVID in the hospital. And then the next graph here is the morning census here at the medical center. We currently are sitting at 29. Fred, of those on our campus, 16 in the ICU, 9 on vents, and of those, I think 12 no longer infectious.
That's right, Dennis.
So those are the numbers today. Fred, capital region percent positive is just under 2%, so it's still staying in that range?
It's hanging in there. It's been there really since about Valentine's Day.
Right, so 1.9% today. Today is, in fact, the 1-year anniversary of the World Health Organization declaring COVID-19 to be a global pandemic. And so Fred thought, and I completely agree, it's a great idea to kind of give the 1-year perspective, look back on this campus.
You know, Dennis, it's really been a profound year for us. So
No doubt.
I think a little reflection on what's happened is actually very valuable. So let me tell you what the numbers have been here at the medical center. So in the last year, we have had 2,067 patients with COVID here at the medical center, both inpatient and outpatient. 1,496 of them were admitted into the hospital. So about 3/4 of them got admitted.
Right.
482 of them wound up in our ICU, and of that population, 202 wound up on ventilators. And Dennis, I think the most disturbing number here is the mortalities. So here at the medical center, we've had 228 deaths from COVID-19.
Yeah.
It's a large number. It's not something we see really with any other diseases.
Right, I mean, of course, the numbers are one thing, and then there's the human piece to it, and
That's
all
right.
the work behind the scenes that people did, but those numbers do sort of put it in perspective.
It really does, Dennis, and it speaks volumes about our staff. Think of all the hard work of all the nurses, doctors, technicians,
Yep.
EVS people. I'm skipping and missing, I'm sure, but everybody in this institution who cared for all those patients.
And continue to do so.
That's right.
Okay, thank you for that, Fred.
Yes, thank you.
Let's jump into some vaccination numbers. These are good numbers. This is the capital region. As of today, there's 267,000 people who have received at least 1 dose of a vaccine, so that's 25% of the population. 130,000 have actually completed the vaccine series, so that's about 12%. And over just the last 7 days alone in the capital region, we've had 54,000 people get a shot. So you can start thinking about, okay, over the next 2-3 months, what could that translate into? It starts getting to big numbers.
It starts getting to herd immunity.
Speaking of vaccines, tomorrow on this campus is the last clinic where they'll be giving the 2nd dose of Moderna. I think it's from 7 to 11. But Fred, we wanted to share some perspective on that being the last day for that clinic on this campus.
That's right, Dennis. So the clinic that we've been running down in the BE entrance has delivered 18,000 doses of vaccine. Just unbelievable. And you know, I sometimes stand on the first floor and look down through the windows and watch.
Same.
It just moves right along. It's the most efficient clinic. It's just incredible.
Well, when you think about it, not only 18,000 people, but the very first dose of COVID-19 vaccine was delivered in the capital region right there.
That's right.
And that was a pretty remarkable day. So congratulations to everybody who made that happen. We've often sung the praises of 1275 Broadway and the work there. We equally sing the praise of the BE entrance and the vaccine clinic down there. So congratulations.
Thank you
and
all.
If you're due for your 2nd dose.
7 to 11 tomorrow morning.
Now, speaking of which, Fred, a couple people have stopped us periodically. They're employees here. For various reasons, they may not have gotten the vaccine when it was eligible or when it was available many times. And they say, I think I want to get it now. So what's our advice to them?
They can go to Capital Region Vax.
CapitalRegionVax.org.
And look for an appointment. And as a healthcare worker, there are 1A.
They are.
And they will be at the top of the list to get vaccinated.
They are, and starting next week, obviously they'll be able to get vaccinated at local health departments. They'll be able to go to the pods, whether it be at SUNY or at Queensbury when that's open. A lot of different locations. We encourage you still to seek that out.
It's important for you, and it's important for the health of our patients.
For sure. Fred, how did visitation go yesterday on this campus?
Dennis, it went well. So again, over 300 visitors between the hours of 10 and 12 in the morning, and then again 6 at night to 8 p.m.
When I was walking out, I saw the line of people coming in, and I saw at least 4 different areas where people were checking in. So they were moving through pretty quickly.
They are.
About, it takes about a minute to check somebody in, so maybe 4 per minute were coming in, and security and others were assisting with that. It was great.
And Dennis, there have been a few bumps. We're lighting up the process again after a couple of months of not having visitors. So some of the forms that need to be faxed and moved around haven't happened as fastly as they should, but we'll be fine.
Is visitation open up in the outpatient settings like in the practice clinics?
A very important question, Dennis. So the visitation changes are only for the hospital. The practice sites, even if they're in our campus, our physical footprint, have a different policy, and they have not yet opened up the way we have. They're concerned about, the exam rooms are kind of small, and having 2 or 3 people in there, you can't social distance.
Okay, so and when that opens up, obviously we will announce that here.
Yep, we'll make sure everybody knows.
Fred, there was an article recently that you were referring to that talks about reflections on this pandemic and how it compares to another one that we've learned about in the history books, which is the Spanish flu. And you've talked about this many times. There's many comparisons.
There are many comparisons, Dennis. So this is a short piece in the British Medical Journal today, because today is that 1-year anniversary we spoke of, written by a historian and a history student. And basically they talk about some of the parallels. So let me point out some of those parallels. So the Spanish flu pandemic lasted about a year, had 3 waves, which we seem to have had here. It had an economic effect on society. It had controversy. Interestingly enough, there was controversy about masks and would masks protect you. The whole thing about disinfection and trying to prevent spread that we've lived through, etc. At the end of the year, as it was starting to wind down, there was a sort of a fluctuation in the mood of the public, which I think we're starting to see now. Optimism and pessimism, this is going to end, or it seems like it is ending, kind of that fluctuating back and forth, and it seemed to happen then as well. In terms of what happened to patients, interestingly enough, the same kind of comorbidities we're seeing today with bad outcomes they saw back then. And finally, they point out that physicians back then, over 100 years ago, dealt with many of the same challenges as we're dealing with today. No cure, somewhat ineffective treatments or marginally effective treatments for patients, and some of the mental health stresses that all of our providers have felt. Same thing happened back then.
If someone wants to read that article,
British Medical Journal, it'll be posted. The library here, the Schaefer Library, will post that for you. Take a look. It's a short read. It's only a couple pages.
Fred, you mentioned about health conditions making people at risk for it. The weather's getting warmer. I'm going to say it again. We've learned high blood pressure, obesity, diabetes are risk factors. Weather's getting nicer, maybe a good chance for people to get out, get some exercise, get healthy.
Dennis, I went for a walk yesterday at the crossings in Colony. There was no place to park. So people are taking your advice already.
Good.
Even before you give it.
Good. All right, last thing, probably the best news we have all day. Albany Business Review puts out a list every year. They call it the 40 under 40. These are people under the age of 40, and they're recognized for their incredible work in the last year. And we have someone very special this year to recognize.
Very special, very special.
Go ahead, Fred, you do it, please. You take the honor.
Our own Matt Markham.
Matt Markham, who's in the room with us here right now.
Yes, I'm looking at him right now.
Yeah.
He's blushing.
Yeah.
But a well-deserved honor, absolutely.
When you think about all the things that Matt and his team have done over the last year, the way in which we've messaged not only internally but externally, the importance of our communication, our message, and how we deliver it about the pandemic to keep people up to speed on this important event. he's been at the center of all that. So
Absolutely.
congratulations to
Thank
Matt.
you.
Well deserved. Well deserved.
Congratulations,
And joins a
Matt.
list of luminaries here in the past who have won it
That's
as
right.
well. So
That's right.
congratulations to them as well in the past. That'll do it. We'll be back again on Tuesday of next week. I think on Tuesday of this week, I said we'll be back again on Tuesday, but I meant Thursday. So now I'm getting it right. We'll be back again next Tuesday. Have a great weekend. To those that are working here on this campus, we appreciate you. We ask that you once again, please take care of yourself, take care of each other, and we'll see you next week.